So insurance policies can be customized. All insurance policies can be customized. That's why even health plans can be customized. Let's start there. It should all be about your need. Don't buy a policy just because your insurance agent said, Nunua hii, this is it, don't do that. That's why we have people who are disgruntled. You need to understand what are your needs and how will they accommodate you. I've met many people who signed up for the savings plans, especially signed up for savings plans a long time ago and education plans, but they bought because the agent said, buy for 5,000, buy for 10,000. Okay? And when it got to the time, you've been paying for 15 years, but when you look back at how much you're getting back, it doesn't make sense. So anytime you start planning those investments, you must have a goal in mind. You must always have a goal in mind. What do you want to achieve? In how long do you want to achieve it? How much do you need at that point? What's your disposable income? Because also you don't want to put in too much and then you're suffering and then you default on your policy. It needs to be a very well thought out plan, and a good agent will ensure that you're doing a balance sheet. We're looking at your expenses, your daily expenses, your monthly expenses, the essentials that you must have. And then we're looking at what can you cut out and actually be able to live without to be able to achieve this other goal. So yes, insurance policies can be customized. Okay. Medical insurance should also be, it's not one size fits all. You could be in a family where people are very prone to dental issues. Then you need to have dental. You could be in a family where there's an inherited sort of chronic illness. When you're buying your insurance, you need to look at your chronic limits just to ensure that the cover suits your needs. If you're a family and you really don't have people who use the outpatient much and your children are grown, this is a tip, and your children are grown, that means you really don't do much of the outpatient. So save money. You really don't need the outpatient. Have the inpatient cover alone, because really, you know what? That's where rubber hits the road. That's what would bankrupt you, having to pay inpatient costs. Outpatient, if you ask me, I feel like many people would be able to afford that. But the inpatient part, that's the hardest.